Hello, good afternoon. Thank you everyone for joining us. This is our healthcare policy breakout. I'm really excited today to bring to you members of Planned Parenthood and the National Health Law Program coming out of the DC office. With us today is Lindsay Robinson. She's the director of the State Strategy Advocacy at Planned Parenthood Federation of America and Planned Parenthood Action Fund. She co-leads the National State Fights team to defeat or mitigate state legislative attacks and supports affiliates' proactive efforts to expand equitable access to sexual and reproductive health. Prior to joining the national office, Lindsay was the North Carolina Director of Public Affairs for Planned Parenthood South Atlantic and Planned Parenthood Votes in South Atlantic as well. Thanks, Lindsay, for joining us.
Thank you.
Next, or with her, is Madeline Morcell. She's a staff attorney in the National Health Law Program's DC office and executive coach at the Public Health Leadership Lab at Harvard University. She focuses on health equity and reproductive justice issues in Medicaid and federal health care reform. Before joining NHELP, Morcell served concurrently, as Director of Public Benefits Law at the Mississippi Center for Justice and a fellow at the Mississippi Women's Policy Institute. So previously, she's a staff attorney with the Network for Public Health Law and research scholar at the Center for Public Health Law and Policy, Sandra Day O'Connor School of Law. She focuses on her practice research and teaching on law policy and politics of health justice. So you are in very good hands with both of them. I will leave you to it. And after the presentation, there will be some time at the end for Q&A. So just feel free to drop those in the chat box to the right, and we'll grab them from there. Take it away.
Awesome. Thanks, Rakia. Thank you, everyone, for attending this healthcare breakout today. A special thank you to Will for having us here to share a little bit about what goes on in our world and to talk about how legislators can support policies that ultimately ensure increased access to healthcare. Again, my name is Lindsay Robinson. I'm the Director of State Strategy Advocacy at PPFA and PPAF. And my work at the organization really focuses on what Rakia said, defeating and or mitigating state legislative attacks and supporting affiliates in their proactive efforts to expand equitable access to healthcare. And then I'm going to pass it over to Madeline just to introduce herself.
Hi, everybody. As previously shared, I work on health equity and reproductive justice issues as a staff attorney in the National Health Law Program's DC office, and I'm going to be talking about issues that are hot button issues right now in Congress related to reproductive justice and intersecting health equity issues.
Awesome. So y'all, just in terms of a quick agenda, here's kind of the breakdown. I'll give a quick overview of the abortion access landscape. I know you guys have seen that has been in the news, and it's quite a hot topic right now. So I'll quickly give an update on that. Then Madeline will provide an overview of key congressional opportunities to promote reproductive health equity. I'll come back and give a quick general guidelines on how y'all as state legislators might think about supporting those policies that will ultimately increase access. And then again, we'll open it up to general Q&A. In terms of housekeeping, we're going to ask that y'all hold questions till the end, but feel free to put questions in the chat, and our awesome colleague Ro will be taking note of them. So in terms of the state of healthcare access, I want to address quickly the current landscape and then healthcare access trends, specifically SRH. So baseline is we cannot achieve equity in healthcare without assuring abortion access for all, right? Abortion is healthcare, put simply. The right to abortion is simply under attack in this country. And in hostile states like Texas and Mississippi, bad bills are making it to the Supreme Court, fundamentally attacking our basic rights. So next slide. While today's presentation will really be focused on options to expand healthcare, I just wanted to take a moment to note that on record, this has been the worst year for abortion rights since Roe. More restrictions have been enacted in 2021 compared to any other year. And these rights, again, are on the front line in front of the Supreme Court. This is a crucial time and opportunity to ensure proactive measures to protect abortion care. And regardless of what state you're in, protecting SRH is a really important goal. This means maternal health, access to contraception, family planning, and more. So, as I mentioned before, abortion access is under attack. We've seen nearly 600 abortion restrictions introduced this year. Over 100 have already passed this year. And these include things like bans on different types of abortions, onerous restrictions on doctors who provide that care, and just various restrictions in general that impede that access. So, a lot of you guys have heard about Texas Senate Bill 8. That is one of the most egregious that we've seen in terms of restrictions. It's a 6-week ban that was passed in May and went into effect September 1st. Essentially, what you need to know is that it bans all abortions after 6 weeks, which we know effectively bans all abortions because most women don't know that they're pregnant at 6 weeks. So, in addition to the laws that are already on the books in Texas, it basically makes it incredibly difficult to receive abortion care. Also, this bill has a really unique cruelty to it in that there is a private right to action in this bill, which basically means any individual can sue someone for providing in abortion care or providing practical support to a patient and can win judgments of up to $10,000 or more. So, for example, if you're an Uber driver driving a person to a clinic to receive this care, you might be at fault. This, of course, opens up clinics to frivolous court cases and legal fees and really makes it impossible for providers to stay open. It really sets a dangerous legal precedent and could clear the path for states to override people's constitutional rights. Next slide, please. So when we look at states that are poised, to ban abortion, if you look at this map, there are 26 states poised to ban abortion in a world in which, if Roe fell. And when we say poised to ban abortion, what I mean is if Roe was overturned or gutted, we believe these are the key states that would move to ban abortion by introducing legislation in the state legislature. So many of the states that you see on this map have pre-Roe bans on the books and bans abortion in state law that were enacted before Roe that are still obviously there. In the absence of Roe, these bans would still be in effect. Some states also have trigger bans, which ban abortion contingent upon Roe being overturned. In addition to all that, there are some of these states that we see they just have political environments and legal environments which their state courts could create opportunities to move to ban abortion relatively quickly. So I know that was a lot of doom and gloom when it comes to healthcare access and the right to an abortion, but want to kind of shed some light on some proactive efforts. Right, it's not all negative. There are some good things going on in the states, and I want to tune y'all into those. So just some top lines on the proactive landscape in the states. This year we saw 10 proactive bills that were enacted in 9 states. 2020 was definitely an off year, I would say, due to COVID, but it's really on par with what we saw in 2019 as well. So some highlights here. Hawaii repealed its physician-only law, which basically allows advanced nurses to provide abortion care, which is great, right? So it's not just MDs or who can provide abortion care. New Mexico repealed its outdated pre-Roe ban on abortions, which means that is off the books there. And lastly, Washington State passed a law requiring public university student health plans that provide maternity care to also provide abortion coverage. And so on the next slide, you'll see kind of a visual breakdown of bills filed in 2021 that seek to really expand abortion access. And if you look at that visual breakdown, you can see that many of these bills really do seek to repeal restrictions or expand abortion coverage in insurance plans. Next slide, please. So, kind of a place where a lot of people can meet in the middle would be maternal health care. It's a rising trend in terms of state policy landscape. Quality maternal health is consistent across states, which have a huge impact, of course, on minorities, people of color, in particular Black women. And again, the goal would be here to ensure that all people, no matter where they live, have quality to access maternal care. State legislators have taken charge of this trend with over 250 bills introduced across the country that seek to improve maternal health care. Big states where this happened was New Jersey, New York, as well as Texas. And these bills really aim to do a lot of things, from providing trainings for healthcare providers on implicit biases, expanding access to doula and midwifery care, and improve access to maternal health care as well. Many also look to improve maternal mortality review commissions, which are state multidisciplinary committees that review pregnancy-related deaths and make policy recommendations. So quickly, two trends to highlight here. Currently, the federal Medicaid statute requires just 60 days for postpartum coverage. Many states have taken charge to extend this coverage to 12 months. So increased access to affordable healthcare really being crucial here to reducing harm for potential complications for women. 7 states, including the ones that I've mentioned here, have passed legislation to extend postpartum coverage to 12 months. So that's great news. Doulas and midwives are also really crucial in the caregiving model beyond just traditional hospital care, and are associated really with great maternal health outcomes. So many states have passed measures to expand doulas and midwives through insurance coverage and reimbursements as well. So really the main point that I want to drive home here is that maternal health is really a great place to start in terms of focusing efforts to expand access to healthcare. And just a little bit more on the next slide in terms of sexual and reproductive healthcare efforts. A couple other things here I wanted to point out. Sex education in schools is obviously an important aspect in healthcare, another great point to start. And understanding sexual health from a young age is always important. And just a couple of states to highlight, you saw in Alabama, they updated their sex ed laws to have a medically accurate requirement and struck dated anti-LGBTQ language through its first abstinence first. In Illinois, we passed a comprehensive sex ed bill that is a disability and LGBTQ inclusive, while also forward thinking. And then again, in Virginia, the Department of Education is required to review sex ed curricula. Similarly, in birth control, contraception has improved over the years. In Arizona, Illinois, and Virginia, those states passed bills that really expand access to contraception at the pharmacist. So either allowing pharmacists to dispense contraception or prescribe it. And a handful of these states also extend supply provisions, allowing patients to get more than 1 month supply, right? So 12-month supply at one visit. And at this time, I'm going to pass it over to Madeline to give us the federal perspective.
Thanks so much, Lindsay. So I'm going to talk about, there's so much happening related to reproductive and sexual healthcare access, reproductive justice, and broader healthcare access right now in Congress, particularly related to Congress's budget reconciliation legislation, the Build Back Better Act, and also so much happening in abortion access and beyond, and so many issues. But I'm going to really focus on budget reconciliation today, as well as some really key pieces of legislation related to abortion access. Next slide, please. So I'm going to start by talking about closing the Medicaid coverage gap. It's been really encouraging to see the momentum on getting coverage to the between 2.2 and 4 million people that at any given time should be covered through Medicaid expansion, but aren't because of state decisions, 12 states' decisions to refuse expansion. Since 1965, Medicaid has played a critical role in the struggle for healthcare access for underserved communities with low incomes. And for nearly a decade, Medicaid expansion has furthered that work by improving health coverage, access, and outcomes for nearly 14 million people, saving tens of thousands of lives. We've seen that particularly for people with chronic health conditions, people with disabilities, addressing issues like our Black and Indigenous maternal health crisis. We've seen narrowed racial health inequities as a result of Medicaid expansion as well. So really important policy changes. Unfortunately, as I mentioned, between 2.2 and 4 million people at any given time are not enjoying those gains to health equity because of the Medicaid coverage gap. That's been especially dire in the context of the COVID-19 pandemic. 60% of the people who fall into coverage gap are people of color, which is a disproportionate number of people of color in the coverage gap, and 97% of the people in the coverage gap live in the South. Next slide. Something that NHELP has been really deeply engaged in is thinking through what an equitable federal fix to the Medicaid coverage gap would look like. For us, there are 4 buckets of issues that any federal coverage gap solution would need to address. The first is comprehensive benefits. Medicaid includes so many benefits that are just simply not included in private health insurance. Things like non-emergency medical transportation that help people get access to care, home and community-based services that help low-income people with disabilities stay in their communities, and just so many other services that private health plans, including in the marketplace, just don't cover. There are really critical affordability protections, premium and cost sharing caps, no enforceable cost sharing for people under 100% of the federal poverty level, really important enrollment protections that enable people to get access to care and avoid medical debt and bankruptcy that we see so often in this population for folks that don't have Medicaid coverage, and really important due process protections because Medicaid, like other public benefits, it has a constitutionally protected property interest. And so there are really robust consumer protections as a result of that. Budget reconciliation, we've been very excited to see, is focused on closing the Medicaid coverage gap. In the version of bill text that was passed out of the House Committee on Energy and Commerce a few weeks ago, the framework for closing the coverage gap would be marketplace coverage for a few years while the federal government sets up a new federal Medicaid program that would be designed to mirror the comprehensive benefits and protections that exist in Medicaid. Something that we're anticipating to see, though, as the top line cost of the legislation is likely to soon decrease, is that the duration, scope, and very inclusion of a coverage gap solution could soon go away. And so something we've been very engaged in is making sure that any coverage gap solution, whether it's based in a federal Medicaid program or the marketplace, ensures that people are receiving access to the same comprehensive coverage that they would be getting through Medicaid expansion. And that parity is really important because what we don't want to see is a separate and an equal system of coverage for people in the coverage gap. We're really concerned that we could see backsliding where current expansion states could reverse their expansions and leave the people that are now in the coverage gap as a result of that to that lesser standard of health coverage. And we're also really concerned that this could set a precedent for a future Congress to say, well, in the past, for the coverage gap, Congress already said that a lower standard of health coverage is okay for people who should be getting Medicaid. And why can't we do that for all of Medicaid? And so the stability of the Medicaid program writ large could be endangered. So we're paying a lot of attention to those concerns. If we do end up with a marketplace solution, we want to make sure that it has add-ons to mere Medicaid protections and benefits. Next slide. I also just want to build on what Lindsay talked about around extending postpartum coverage. Budget reconciliation does seek to build on all of the momentum that is happening right now. As Lindsay mentioned, the status quo under the Medicaid Act is that post-pregnancy coverage lasts until the last day of the month in which the 60th day after the end of a pregnancy falls. So it's basically end of pregnancy date plus 60 days, and then you go to the end of the month in which that falls. That's not a lot. We see so many pregnancy-related illnesses and death fall in actually like after that period within the 1 year post-pregnancy period. So it's really important to extend that coverage. The American Rescue Plan Act earlier this year created a temporary 5-year state plan option to extend the duration of coverage to 12 months after pregnancy's end. The Build Back Better Act would build on that in a really, really important way. And it would require all states to extend pregnancy-related coverage to 12 months after pregnancy's end. And that would be just a boon for maternal health equity, because it would cover, according to the Century Foundation, over 1.1 million uninsured new parents over 10 years. So it would be really incredible. Next slide. Thank you. I just also want to mention that there are provisions of the Black Maternal Health Omnibus that are also included in the Build Back Better Act. This is really exciting. The Momnibus is comprehensive legislation that has been championed by the House Black Maternal Health Caucus. And this legislation has been really championed by Congresswoman Lauren Underwood, and it would do a number of things to address the drivers of pregnancy-related morbidity and mortality, particularly for Black, Indigenous, and other people of color. Build Back Better Act doesn't include all of the Omnibus, but it does include provisions that are money-based in nature enough that they would survive what's called the Byrd rule. So for budget reconciliation, things need to be financial enough in nature that they pass this rule. And I won't list out everything right now, but there are some really, really critical provisions that have been included in the Build Back Better Act, grants to address drivers of maternal mortality, supports to expand the use of telehealth, and provisions to address the social determinants of poor maternal health outcomes as well. Next slide. And I also just want to acknowledge, as Lindsay said, abortion rights are under attack right now. Reproductive and sexual health writ large is under attack right now. Abortion is healthcare. Abortion is a really critical service that allows people to enjoy their right to bodily autonomy, and it is a constitutionally protected right. Medicaid aims to provide comprehensive health coverage to people with low incomes. We cannot have comprehensive health coverage without abortion. Right now, we're in a moment where the reproductive health rights and justice movement is fighting to secure that right through litigation and in Congress. Um, you know, we really need a holistic, multi-pronged legislative strategy to ensure access for all. And fortunately, Congress can and must do quite a bit to address various barriers to care. And here I've just listed out three really critical opportunities to do just that. The Women's Health Protection Act is particularly pertinent in response to what's happening in Texas and Mississippi. It would protect the right to abortion care free from medically unnecessary restrictions and bans. And in a historic vote, it actually passed the House of Representatives with 218 votes about a month ago, which was an incredible win. But it's also worth mentioning that not everybody really is able to access that right, even under Roe. As people of color have said for decades, a right doesn't mean a whole lot if you don't actually have access to exercise that right. And a crucial facet of that is health insurance coverage. In order to promote reproductive justice, we need to end the Hyde Amendment, which is a restriction that was first passed in 1976. It's a budget rider that is included in annual appropriations legislation and has been every year since that time. It really severely limits abortion coverage, except in extremely limited circumstances. And in order to promote reproductive health equity and health equity as a whole, we need to ensure that people can access care. And so in another really historic series of landmarks, earlier this year, President Biden became the first president in decades to send a budget to Congress that did not include the Hyde Amendment. In July, the House of Representatives passed its appropriations legislation without Hyde in the provision that governs healthcare funding for health programs, including Medicaid, the Indian Health Service, and more. And just this Monday, the Senate introduced its own version of the Labor H bill, the provision that governs health programs that did not have Hyde, becoming the first to do that since the provision was first created in 1976. So we have some really amazing momentum. And it's worth mentioning, just as a part of that, another thing that needs to move in concert with ending Hyde is the Equal Access to Abortion Coverage Act. This really important legislation would require, Hyde would remove the restriction on funding. Each would actually require abortion coverage in Medicaid, CHIP, IHS, and other federally funded health programs. It would also prohibit government interference in private health plans' decisions to cover abortion care. So really important legislation. We're really excited to see these things moving. And with that, I will turn it back over to Lindsay to talk about advocacy.
Awesome. That was great, Madeline. Thank you so much. So really briefly, wanted to discuss kind of tips on engaging with healthcare policies, a starting point for where you might think about beginning this quest to expand access in your state. I want to preface this by saying that I defer to you guys. You guys are the experts in your state. But here are just some guidelines and some bullets for consideration. So one is to, make sure that you are engaging with local stakeholders in your communities to gain a really holistic view of the environment, right? That is crucial. Making sure you know who the stakeholders are, who are the players, who this might affect, and who it might not affect, right? Next would be to use your resources. And so, your local Planned Parenthood affiliate will be a valuable resource in your quest to kind of expand access. Learning from people who are on the ground providing healthcare can be really helpful in terms of understanding policies to expand healthcare access. Specifically, and strategically uplifting those needs is really vital. So to hear it kind of from the horse's mouth is always really great, and I think really can oftentimes drive the work. And Ro, would you just mind going to the next slide, please? Thanks so much. Also along those same lines is, PP is not the only avenue, in the repro world, right? For years, reproductive justice, the RJ movement, has really been steering folks in the right direction before Planned Parenthood was. And the RJ movement has really been led by Black women. And, we try to work with reproductive justice groups, but they're really doing the work. So, in your area, RJ groups are always a great avenue. They oftentimes find points of intersectionality. So, they might be able to tell you about what's going on holistically in terms of what does food security look like? What does housing security look like? And how did that plays into overall health, right? So working with them, through that lens is really crucial and incredibly helpful. And then again, as you all know, cross movement groups are a really great starting point as well. Working with those local organizations on a variety of issues, anywhere from gun violence or gun safety to climate change to, Medicaid expansion groups. Together, y'all can really build coalition power. I would try to meet with these groups regularly to assure alignment, but use your voice, use your platform. I think a lot of times people just think of using your platform as being the one who is front and center. But oftentimes we need folks who are working with members behind closed doors, moving things along and working in tandem with other folks. So when I say use your platform, that can be in a public way. That's always great, but also privately, right? In your community and talking with other members as well. And the last big point here is, in summary, kind of know your state, right? Know the players, know what's going on. That is really crucial. To even know if there's an appetite, right? And where that appetite lies and how you might be able to work around that, right? So just in summary, engaging with the RJ community will always steer you in the right direction, working with local Planned Parenthood affiliates, public affairs staff, to understand what's going on, knowing, you guys are players in the political environment and the legal environment, but just knowing the landscape of the state is always incredibly helpful. So just kind of wanted to provide some guidelines and tips. I hope you guys find those helpful. If anything, just a refresher, because I know you guys are always, doing this day to day and are very familiar. So y'all are the experts. But that concludes Madeline and I's presentation. Would love to open it up for questions and discussions. If we don't know the answer, we will certainly try to get back to you as soon as possible. So please feel free to use us as a resource, and just thank you so much for your time today. We hope you guys found this helpful. That was our intention and our purpose. So thank you.
Hi, this is Rona BR from Planned Parenthood. Thank you so much, Madeline and Lindsay. We do have 2 questions, so I'll turn it over to Anne. Anne, feel free to come off mute and ask the question.
Yeah, I'm just, hi, Ann Hughes from Connecticut, legislator in Connecticut, and we did extend a year of postpartum maternal care, and we're really excited about that. But that, again, that's only for 5 years. But we're noticing, because of hospital mergers, that it's a reproductive justice issue, that there are reproductive maternal and labor delivery deserts in Connecticut with no highway access. So if you go into labor and you can't get from Wyndham to Hartford Hospital quickly, you might have to be helicoptered. And that is not reproductive justice, just like access to abortion care, which we did codify in statute in 1990 to protect against the overturning of Roe v. Wade. But that statute could also be repealed if the leadership is taken over by extremists, which is happening also in some of on our local level in small towns. And so no state is quote unquote safe, and no state has really adequately championed reproductive justice for everybody, because we have prioritized big hospital for-profit centers that have merged and taken over all the nonprofit and independent hospitals. So we only have 3 big hospital systems left, and they are closing their maternity and delivery wards. I mean, some of them. I mean, not all of them, but for access, for justice, for and that just creates tremendous stress. So what I was saying is, how can we prioritize legislatively as a right, standalone federally qualified health center, maternity, labor and delivery centers for access for everybody?
Thank you so much, Anna. Can you tell me again what state you're coming in from?
Connecticut.
Wonderful. Thank you so much for joining the day.
And we do have a doula. Everyone deserves a doula movement, but we have not gotten that over the finish line as a doula care as a right. But we have an atrocious Black maternal and infant mortality rate in one of the best healthcare systems in the country. So we are the poster child for, maternal and health racism.
Yeah, I think that, thank you so much for raising this issue. It's a really important one. I think, and I want to hear from Lindsay as well. 2 things that I'll just flag. A lot of states have begun to introduce, and in some cases pass, legislate their own version of the federal Black maternal health omnibus. Which in some cases map pretty much exactly, and in some cases include their own tailored provisions to really comprehensively address maternal health care access and broader reproductive justice issues that are driving our national Black and Indigenous maternal health crisis. And that's a really critical piece, addressing workforce issues and investing in providers that are really focused on addressing underserved communities, as you've noted. And I would be happy to connect offline if helpful. Our reproductive and sexual health team at the National Health Law Program has been providing a lot of technical assistance in helping to draft and support local advocates and policymakers in moving omnibuses forward. I'll also flag, related to that you mentioned a strong doula movement in Connecticut, that another area where particularly my colleague Amy Chen has been really, really focused is on our Medicaid doula project and working to get state reimbursement for doula care, and has crafted legislation and supported advocates in passing to get that coverage for a really, really critical pregnancy-related health service. And I know Lindsay must have a lot of ideas and opportunities to share as well. So I want to turn it over to her.
Yeah, no, Madeline, I thought that was great information you provided. I will say, I think that what you mentioned, Anne, really is a challenge. And we're seeing that. I live in North Carolina. And so same type of situation is happening, the closing of hospitals. particularly the rural hospitals where it is already really difficult. That whole rural aspect does make it really challenging as well. We have a small team of folks at the organization who focus on maternal health in terms of access and working with state legislators as well. But I think, it's a real challenge, and it's really unfortunate that on top of maternal health, these points of intersectionality where we look to doctors for help, they're just not there, right? Like Madeline said, the workforce, it's not there. And in a lot of these rural and underserved communities, you're dealing with, interpersonal violence. You're dealing with, housing insecurity, food insecurity. So there's a lot of things going on as well. And so, again, that holistic viewpoint is something that is really crucial. That I think we're all really missing the mark on. And so I'm trying to encourage folks, in that direction of really looking at a person holistically as well. And I find that you meet a lot of different points of intersectionality when you think about things like that. Thank you.
Great. Thank you so much, Anne, for that question. And Rakia had a question that she popped in. What top 3 recommendations would you make to legislators who are trying to tie healthcare reform into their election campaign platform?
That is a really good question. Madeline, do you want to start or do you want me to start?
If you want to start, I have thoughts, but happy for you to start.
Sure.
Lindsay.
Sure. So, I think one thing that is really important when I think about the work that we do is not siloing healthcare. I think we have a tendency to silo healthcare into different buckets. And I think really thinking about healthcare as what it is, healthcare, right? And the provision of healthcare and access as one huge umbrella is incredibly helpful. Instead of siloing things. And so when we talk about healthcare, just talking about it generally and everything that includes, including abortion care, is really beneficial for folks to try to understand that. I think that kind of, requires a shift in thinking. And then just going back to my PowerPoint too, in terms of like knowing your state and knowing what your constituents or the people are interested in, what are some of their unique challenges. And in addition to that, what are other areas that you see where there might be some unique challenges where you can tie things together, right? I see that done a lot as well. Madeline?
Thanks, Lindsay. I totally agree with everything you said. I think we need, people don't lead single issue lives. And when we're talking about healthcare, we need to do so in an intersectional way. I think, when I think about this question, I think about the work that I've done living in many different states, most recently in Mississippi, and just, like Lindsay said, context matters, and the messages that will land best so hinge on where you are. I think about, I worked really extensively on Medicaid in Mississippi. I also worked on broader public benefits issues, and I think about legislation that we were able to get passed on a really critical reproductive justice issue, which is a federal opting out of a federal lifetime ban on SNAP and TANF for people, mostly women of color with drug-related felony convictions. And the reason that we were able to get that passed in a deep red state was because there was a multi-year movement for criminal justice reform. And we were able to really frame that issue and explain that issue in how it intersected and would be so beneficial from a criminal justice reform standpoint. And so I think context so matters. Windows of opportunity open and close. I also think about right now, during crises, often the window of opportunity for change opens a crack. And right now, with the COVID-19 pandemic and the Black maternal health crisis, which is really an epidemic in and of itself, there are so many crises that our country is facing right now. And I think that really leaning into and seizing the opportunities that come from that urgency is really important. And I think more than anything else, really having an understanding, connecting, like Lindsay said, with reproductive justice activists and legal aid organizations, your Planned Parenthood affiliate, and others who really have an understanding, and your constituents broadly, who really have an understanding of how these issues are impacting, how needed policy changes and the lack of action on critical issues are really impacting individuals' lives. And telling those stories, I think, is such an important piece of tying healthcare reform into election platforms. So those are just some initial thoughts, but I'm sure, I would also love to hear, we're coming up on time, but if attendees have thoughts on that too, I'd love to hear from the chat or elsewhere, because I recognize there's so much expertise in that you all hold as state lawmakers. And I also really appreciate what Anne dropped into the chat about healthcare access being a human right. I think that is a really important baseline for work on healthcare and intersectional issues that relate to the systems of oppression that shape inequities in our country and in our communities.
Great. Thank you so much, Lindsay and Madeline. I don't know if there's any other questions. I didn't see any in the Q&A, so just want to come on screen and first of all, thank you all. We are coming down on time. I really loved your points on intersectionality. I think they were spot on and really well taken. I think we as women know how to navigate that politics really well. And it's also really essential because all of these things are connected. And
gosh, yeah.
As we had talked before, and as the legislators will know, have following along this month, economic security is tied in here, as well as climate change. We had talked about that last week, and now health. We had heard earlier today how the risk of nuclear threats, also the mining around uranium for nuclear weapons. Anyway, it all ties in. I don't want to run us down through everything, but it all ties in. So I really, really do appreciate your points on intersectionality. If there is nothing else, I will give you ladies back 2 minutes of your day. Thank you again for joining us and for leading our healthcare policy break. I hope all of our legislators were taking notes. I see a few of you in the room here. Thank you, Anne, for joining us on screen. It's always lovely to see you. And thank you to the rest who were able to join us. This does wrap our Health Security Week for the afternoon portion. We'll have our networking dinner tonight with Mara Dolan. She'll be walking us through, speaking of climate, she'll be walking us through some climate risks and a presentation there. Lindsay, Madeline, and Ro behind the scenes on these slides. Thank you again. Look forward to bringing you back at some point in the future.